of these studies led to FDA approval of IPL Optilite treatment for dry eye disease. Thank you, Rolando.
Yeah, I want to thank TFOS for inviting me to introduce the innovation lecture. This is so exciting. So what I decided to do is talk about the 3 things I learned bringing intense pulse light treatment innovation to dry eye disease. And it's going to be very easy because these 3 things start with the letter P. Let me start by asking, how many doctors here are doing IPL for dry eye disease? That is awesome. Now, if I asked this question 15 years ago, there would only be one hand up, and that would be me. So that tells you how long it takes for innovation to come. So I've been doing IPL now for 24 years. The first 5 years that I did IPL, I did it all for free, just trying to figure out parameters and protocols. But this has actually been studied. In the medical profession, it takes about 17 years for a great idea to actually become ubiquitous, like you're seeing with all these hands raised. So this is not a fast process, and I'm giving this for the innovators here. Don't be in a rush. Many innovators come up to me all the time and say, oh, I got this great idea. And then when I check back with them 6 months later, they say, oh, you know what, I abandoned that idea. And I said, why'd you do that? And they go, well, I wasn't really getting positive feedback, and my testing wasn't working, my research wasn't working. And I can tell you, research isn't a straight line, right? We come up with an idea, and little by little, through failure, through success, we figure out how to do things. So the second P is persistence. So when I first approached the industry and the medical community with my idea for IPL, all of them said, this is not a good idea. Many doors were slammed in my face, so you have to have a thick skin, innovators. Don't worry if somebody says your thing doesn't work. But I didn't give up. So finally I met a CEO with dry eye. He let me do the treatment to him, and he said, you know what, you've got something here. So me and him developed the first IPL system that was used for dry eye. So don't give up too soon. So the final P is presentation. So do the research and present your data. Doesn't matter if it's a meeting, dinner, even an elevator. If you got somebody cornered, go ahead and start talking to them about what you do, right? So I couldn't get my data initially published, so I went to social media. This is one thing that I talked to one of the innovators about. And I presented the procedure and patients on YouTube, and then all of a sudden I was getting some feedback and people were starting to ask the question. So this developed an education, and eventually I could publish in journals, and others have been able to publish in journals. So what is the next treatment, and what am I going to, if I have an opportunity to present something that I'm doing? What I'm doing now is using red light, low-level light treatment, where patients actually put this device at home to their lids to actually stimulate the glands to produce a tear. So this is a patented treatment, and if this is the first time you're hearing about low-level light treatment, it's been 14 years that I've been actually working on this. So if you look at my 17-year timeline, in 3 years, this is going to explode. Everybody's going to be doing this, right? Okay, so what is my final advice to the innovators? So this is something somebody told me a long time ago. So first, they will ridicule you on your innovation. Second, they will oppose your innovation. And then finally, if it works, they will accept your idea and it'll be self-evident. So remember the 3 Ps: patience, persistence, presentation. Good luck to all the participants, and thank you for letting me be part of your journey.
Thank you very much.